Carissa again, and in today's video I want to discuss a little bit about your newborn baby and what to expect. So here we have a picture of a newborn. This is the umbilical cord, and you can see they're about to clamp the cord here. Well, it's really important as far as delayed cord clamping. You know, people say, well, do I need to delay or do I not need to delay? Oh no, what if, you know, my baby's blood runs out? Well, that's not going to happen. Your baby's blood is not going to run from your baby back into the placenta. If anything, that blood that is left in the placenta is your baby's blood, and it's the blood that helps them within the next few weeks, and so that's why it's really important to delay cord clamping if possible. You know, if there's no emergency, it's good just to let him hang out, or her, and make sure that the pulsing of the cord stops. And, you know, as we talked about the umbilical cord, make sure that it stops pulsing and the baby gets all of its blood. They say that when they did a study as far as on anemia of babies who had not delayed cord clamping and who had delayed cord clamping, they said out of the babies who had delayed cord clamping, they said that by week 4 they showed less signs of anemia and things like that, whereas babies who had just straight on out cut the cord, you know, they had higher chances of anemia by week 4. You know, it may not have been right after birth, but by week 4 they said they showed more signs of anemia at this point, you know, when their cord had already been cut as soon as it could. You know, they weren't allowed to receive all the blood from the placenta that was theirs. So that's me on cord clamping. You know, but always do your research for yourself. Never take anybody's word for it. Always research things on your own so that you can have the most informed decision. And like I said, the umbilical cord, it'll dry and it falls off usually between 7 and 14 days. Now they have this thing called a lotus birth where some people will not, will leave the placenta attached and have it in herbs and things, and then eventually the cord will fall off. But, you know, so the average length of your newborn will be anywhere from 19 to 21 inches. They'll weigh roughly between 7 to 8 pounds. This is on average. Now, if your baby's bigger or smaller, don't worry. They're all different. This is just the average. So, their limbs, they may be flexed because as the baby is up in there, you know, they may get in some funky positions or, you know, however, and they may come out with their limbs flexed in different weird directions. But don't worry, this is nothing to worry about. You know, they will straighten out and go how they're supposed to. They may have swollen testicles or they may have swollen breast buds. It just kind of depends. Also, young newborn girls, they may even have a little bit of spotting due to leftover hormones and things from the mother. So don't let that surprise you. You know, the chances of it happen are rare, but I mean, it can happen, so don't let it scare you. They frequently urinate and pass stool. The dark stool when they're first born is called meconium. This is a dark, tarry, thick looking kind of stuff. It's really gross. It stains bad, but this is normal. And as they progress, especially if they're breastfed, it'll turn more into a yellow kind of CBE texture. But that first stool, it's black and tarry and kind of looking, and that is called meconium. That's normal. So the skin, it may kind of be blotchy and may want to peel. It depends on the gestation of the baby. Nothing to worry about. And then the baby is also able to find and latch by, you know, reflexes and instincts and senses. You know, the baby can latch on and be able to find. They have that crawl reflex where they'll crawl up the mama's chest to the breast to start breastfeeding. It's built in and instinctual. Just as birth is instinctual, breastfeeding for them is instinctual. And if you're not able to physically breastfeed, in the case of surrogacy or something else comes up and you're not actually able to physically breastfeed, you can pump. But it's really important that the baby gets the first little bit of the colostrum. That's what the first part of the milk is called, is the colostrum, and that's like a really nutrients I'll get it out in a minute. It's a good start for the baby and provides what they need. And as far as when you're breastfeeding, if you can breastfeed, it is ideal, because as the baby latches on, and when the baby is latched on there, the saliva from the baby will also go back into the nipple and into the breast. And that's the way that your body knows what it needs to produce, what levels and what things it needs to produce in the breast milk and what the baby needs. It's really interesting and it's really awesome. And also, as far as breastfeeding, it is also good, I learned the other day, to, if you are pumping, to label what time of day that milk was pumped, because certain hormones like melatonin and things are more present in night milk that will make the baby be able to sleep and rest, versus day milk, which, you know, will keep the baby up in different things that it needs for daytime. So it's really important to, if you do pump, to label it, you know, and if you don't worry about it. But if, you know, if you start doing it, go ahead and start labeling it so that you can use night milk at night and day milk at day. So yeah, that's pretty cool. And they may have jerky movements or reflexes as their body is kind of adjusting to things. They'll have a relatively large head compared to their body, you know, I mean, and that's nothing to be alarmed about. They'll grow. And they may have a swollen or bruised face as they come out. It depends, you know, as far as the time it took and labor and what happened. They may be swollen and they may be bruised, but this will go away within a few days. And the eye color changes over time, and the vision of the baby is best like 6 to 10 inches from their face. They can see better that close, but it's far out. It's not that good just yet. They have a well-developed sense of smell and taste, and they may also have like we talked about the different blotches on their skins and things like that, and also their extremities. Some of their extremities, it may take a little while. They may still be a little blue, and your baby may be blue when he comes out, because like we said, that oxygenation has to reach the whole body, you know. So as it's starting, you have your umbilical cord here, that oxygenation is going, but it may take a little bit to get to the extremities. So your baby may still have like some blue hands or some blue feet or something like that, but just within a few minutes, it'll be perfectly fine and they'll be ready to go. So that'll be all right. So, as we proceed on and we talked about the newborn's appearance, it's normal for newborns to look different than what you may expect. I mean, they're tiny humans, but they're going to look a little different than big humans. You know, their appearance changes over the few days and the few weeks and as they grow. You know, like we talked about, they may have swelling, they may have this head molding. You know, it depends on how long the baby was in the birth canal and how much molding the baby's head really needed to do to fit through there. And it may have a cone head, or the baby may have a weird shape to it, but within a few days, or even within a few hours, you'll start seeing all that go down, and the bruising and the swelling and things like that. We talked about the vernix in this picture. I don't know if you can see it good. It's that white stuff all over the baby. This is that nice protective coating. The lanugo, this is that fine hair that's on its back. Stork bites or birthmarks. You know, you may have those little red spots as we talked about, but you know, nothing to worry about. Like we said, the blue hue to the hands and feet, we've already discussed that. They may get something called newborn rash. It looks kind of like a little light rash, but it's nothing to worry about. If it doesn't go away, eventually you may want to contact your care provider and see maybe if there's something that you've ate, or try to figure out if there's something you've ate in your milk that your baby may be allergic to or something like that. But, you know, most of the time, that's fine. They may have crossed eyes because their eyes are adjusted. You know how we talked about their vision between 6 to 10 inches there, so they're really concentrating, so they may have crossed eyes at times. They may have a little bit of jaundice. Jaundice is the yellowing of the skin due to the production of the liver producing the bile and things like that. But you can let your baby out in the sun like it's a puppy. But you know, you can hold the baby, like strip them down and hold the baby to the window. You want to make sure you get the chest and the abdomen area in the sun well for maybe like 5 minutes a day or something like that. That will help decrease that yellowing, as well as breastfeeding. The more you breastfeed, then the more the baby poops and things. It's getting all of that, the bilirubin and things out that really needs to be out, that's causing the yellowing, and things should be fine. If you feel, if you're still concerned, you can always contact your care provider. And the peeling skin, like we said, that's just a different sign of gestation and things like that. But these are some of the appearances as we talked about. Newborn care practices, another thing called APGARs, which is a score that's given to your baby 1 minute, 5 minutes, and 10 minutes after birth. It's dependent on their respirations, their color, and different things. Generally, 7 to 10 indicates, hey, we're doing pretty good. Below that, we may want to, intervene, possibly resuscitation or something like that. But most of the time, everything is perfectly fine. The midwife or your care provider keeps a close eye on everything, and they'll let you know. Cord clamping, we've already discussed that as far as the benefits of delayed cord clamping. We know that can greatly benefit your baby if that's an option and that's possible. Eye ointment is another thing. It can help with the presence of bacteria or sexually transmitted disease in birth. And that may possibly be harmful to your baby's eyes, and to protect them, they will use this antibiotic ointment to be applied. But you can research that on your own to decide if that's something you would like to do. If you know that you've not been exposed to sexually transmitted diseases or anything like that, you may not care to do that. There's risk and benefits to it, so that's something I suggest you can research, and later on we may do a video on the risk and benefits of that. As far as vitamin K and the hepatitis B shot, these are given a few hours after birth, a vitamin K injection. It helps the baby's blood clot and helps to prevent against internal bleeding. The hep B shot may also be given at birth or delayed. The baby, that's something like, if you don't have the risk to hep B, you can skip. But then again, this is another one of those things that you would need to research and decide on your own how you want to handle. And as far as the vitamin K, like we said, that helps with blood clotting and prevents, excess bleeding. If you see that the baby's had a traumatic birth or something, this may be something that you definitely want to do, to help with blood clotting and things for later on. But like I said, it's a case-by-case basis, and it's eventually up to you. It's your decision, and it's your baby, and if you do well, is to research it and decide. Be well informed. Weighing and measuring in the newborn exam, a thorough newborn exam, and an assessment will be done to estimate gestational age. We'll measure and weigh the baby. We may... it depends on where you're at. You'll get the baby's vitals, and some places they may use like a sling like this to lay the baby in to weigh them. And then you may also have, put the baby in there and just kind of weigh them like that and get their weight, or you may have a regular scale. It depends on where you're at and who you use as a provider. But like I said, we'll also weigh in, we measure the head, the chest, and the abdomen. Assess different reflexes of the baby that the baby has going on. We definitely advocate skin-to-skin contact and all that. So, let's see. Bathing. Bathing can make the baby cold. It can remove that protective layer of Vernex. So it's best to delay bathing, until 6 to 12 hours, maybe the next day. But, if you were to do a herbal bath right after birth with the baby, it could definitely help the cord as far as, healing and things like that from the herbs that are in the tub. Like the mom, generally, possibly at the birth center, you would And it depends on where you're at, or at home, or your care provider. You know, you could do this herbal bath generally once everybody is, you know, had time to bond and everything, and mom would stay in for about 15 minutes. This helps with the perineum and knee healing or anything due from that. And then the baby, maybe 10 minutes or so, you know, put them in a little bit later with mom and hold them to where the cord is right there under the water, and it helps with healing and things. So, but like I said, if not, then just generally you can delay the bath. And you wouldn't really want to wash any of the vernix off. Basically, if you did the herbal bath right after birth, it would just be to set the baby in there and just kind of let that cord absorb those herbs and healing nutrients and things, and then take the baby back out and take the mom out and go from there. So then there's also circumcision if you have a boy. That is an option, or uncircumcised. That's also another one of those issues that you can research on your own and kind of have to weigh out for yourself, risk and benefits and things for that. And then they'll also have health screens. They'll have to detect health issues for early interventions and treatment. Screening is also done. You can do a hearing screen, or, you know, the CCHD, which is a critical congenital heart defects, is, you know, it's usually done a little after, like, within 24 hours or so. It'll go around the baby's hand and the baby's foot, and they test the oxygen flow pre and post ductal, you know, to see how the heart's doing and how everything, and it checks for these congenital heart defects. So, you know, if you're within 3% with one or the other, you know, like say 99 and 98, you're good, or 90, you know, within 3. So then you've also got the newborn screening, which is a heel prick blood test that you will do. You can do one within after 24 hours, and then do one within 2 weeks, and it's just a simple little pinprick to the infant's heel, and they will let it bleed a little, and then they'll put the blood samples on this card, and then they'll send the card to be tested, and this will test for different you know, congenital defects or different things that the baby may have going on. And if you catch these early, most of the time these are the ones that if you catch early, then you're able to do something about it. Whereas if you don't catch them early and then later on they crop up, you're like, oh no, there's not a whole lot. So, I mean, it has its benefits. It's another one of those things, yet again, for you to research, you know what you're talking about, and kind of make your own decision. So, let's see. Yeah, that's about it for today, though. We've discussed things with the newborn, and this has kind of been a long video. Sorry about that. But again, if you have any questions or comments, you know the drill. info@southernhomegrown.com, or hit us up on the contact page, southernhomegrown.com. Have a great day. Thanks.